Users will now have the ability to run a report to reconcile appointment visits with whether a chart note was entered for the corresponding appointment. Please keep in mind that this new Clinical Notes Reconciliation Report will only be useful if you are entering your appointments in Practice Manager. To access this report, go to Reports, Clinical Notes Reconciliation. Start by selecting the date or date range of appointments you would like to reconcile. You can either select from a preset list of range options for ease of use, or you can set a date range using the date dropdowns. Additionally, you may also choose to filter by a certain practice, provider, or account number. If you want to see all records, leave these fields set to all. Likewise, you could also select one of the preset filters from the right. The Mismatch Practice option will show all rows that have a disagreement between the appointment practice and the note practice. The Mismatch Providers option will show all rows that have a disagreement between the appointment provider and the note provider. And the Unsigned or Missing Note option will show all rows that have either an unsigned note or no note paired with an appointment. Once you have set your desired filters, click Run Report. When the results are displayed, if the Note Status, Note Provider, Note Practice, or Note Case columns are highlighted in red, this is a visual cue for a mismatched visit. If you decide to take necessary steps to fix it, simply double-click on the visit in the list, and the applicable patient's chart will then open in Clinical, allowing you to make changes. Along the bottom of this dialog, you will see a legend defining the abbreviations you will see in the Appointment Status column. Likewise, you will also have the option to print the Clinical Notes Reconciliation Report if needed by clicking Print. To close this dialog, click the red X in the upper right-hand corner to do so. Please note, you do have the ability to minimize and keep the Clinical Notes Reconciliation Report open while working in Clinical.